For centuries, education has played a major role in building the minds of our future generation. In the U.S., they are known for pushing students to strive to do their best. But is the push that students are given always beneficial? Some students may be able to handle the pressure, while others may succumb to their largest and often most dangerous weaknesses. Hello, I am Jasmine Merchandani, and today I will be discussing the relationship between drug use and anxiety disorders as a result of 21st century education. Throughout high school, students are going through the most crucial time in their life, puberty. During puberty, students will face an array of emotions, often heightened due to their senses growing. These senses can result in students developing anxiety. But how does anxiety play a role in education? Well, according to Cognitive Behavior Therapy Center of Sacramento Valley, the top teenage stressor for students is school. We combine this along with the distribution level found in the International Study of Nursing Science, where we can see that students are most likely diagnosed with moderate to very severe anxiety and less with very mild to mild anxiety. Just look at the numbers, the top being above moderate anxiety and the second being severe. Because students are facing such severe anxiety, they are acting out irrationally and often practicing dangerous activities. According to the Psychiatric Times, patients with anxiety disorders are more likely to participate in drug dependence and alcohol dependence versus the general population. As we can see here, the blue block, which is significantly smaller, represents the general population, while the larger block represents the patients with anxiety disorders. Not only is it prevalent, but it is growing even today. Since the century has begun, boys and girls have both increased their use of mental health medications by 1%. Now, 1% might not sound like a lot, but it's important to remember that according to the U.S. Census Bureau, there are over 40 million Americans that are teenagers in America. So what is causing teenagers to choose drugs as a result of their anxiety disorders? Well, it all has to do with a dual diagnosis, which can also be called comorbidity. Comorbidity is when a doctor diagnoses a patient and they'll often see growing signs or coexisting signs of symptoms of another disorder. This often includes addiction disorders such as drugs and alcohol, and the most common of them include depression, bipolar, anxiety, and personality disorders. Just as sexes and races differ, so do their responses towards drugs and anxiety. The most common illicit drug use among race is between Native Americans and African Americans, followed by Caucasian, Hispanic, and Asian Americans, found by the NSDUH. We can also see that among psychotropic medication use, which includes antidepressants and ADHD drugs, it is most prevalent among non-Hispanic whites. This is likely due to the fact that more whites are medically treated, while other ethnic groups are mostly self-diagnosed. Among sex, I will review a previous diagram where we see that boys have made the increase of 6 to 7%, and girls have made the increase of 4 to 5% among prescription drugs. We can also see that among marijuana use, women are more likely to develop anxiety disorders, while men are more likely to develop substance use disorders. One contradicting case of this where anxiety disorders do not result in drug use is social phobia, which is a chronic mental health condition in which social interactions cause irrational anxiety. Kind of like what I have. So this does not quite correlate to drug contribution among adolescents, but according to J Youth Adolescent, it can occur into adulthood. Overall, students are stressed no matter what classes they're taking. In fact, the current situation that we're in and the current society that we are putting ourselves in, along with the education system, is making it very hard for students to be aided in their anxiety problems. And if we continue to try to build the minds of the world like this and continue going on the way we are, they may cease to exist. Thank you. What questions do you have?
All right, 2 questions for you. First up, what evidence did you gather that you didn't even use?
I found a lot of evidence correlating alcohol use to gambling, and I didn't really think I could fit gambling with adolescents and alcohol and drugs, so I didn't use that.
And what advice would you have for other researchers who consider this topic?
I would say I wanted to look more into why.
Don't worry about it.
I wanted to look more into why it's more prevalent that whites are medically diagnosed while other ethnic groups are self-diagnosed, so I think that is pretty important for other researchers to look into.
All right. Cool. Thank you.